Also work like if for your would that how would that work from an employer standpoint? Because right now they give you an option, right? So would you also if would you think it'd be better for still the person to pick and not the employer to choose?
Did you ever ask yourself why the employer is providing health coverage anyway?
Yeah,
You know why?
a benefit supposedly.
Yeah, but why did they do that?
I don't know. Tell me.
During World War II, wage and price controls were put in place,
Okay.
and there wasn't significant health insurance at that time. And so the employers, in an effort to try to attract employees, because
Good people.
because a lot of the guys were off at war, so they needed to attract employees. They said, "We got a bright idea. We'll provide health coverage. We'll provide both." Basically, it was Blue Cross or Blue Shield at that time, because that was the only company that was out there.
Really?
And the federal government had to answer the question: okay, how are you going to treat that benefit? Is that a taxable event or a non-taxable event? Does the individual have to pay taxes on what that's worth, that benefit is worth, or is it a non-taxable event? And they decided that it was a non-taxable event, which means that there was then a tax incentive for employers to provide coverage for their employees. And this whole third-party system, this whole employer-sponsored system, grew out of that decision, public policy decision, about how it ought to be treated from a tax standpoint. So employers, because I mean, the guy running the shop down on the corner, he doesn't necessarily want to pick your health coverage if you're working at that shop. That's not his expertise. He wants to run his shop or the grocery store, whatever.
Right.
But because they have a tax incentive for providing coverage, because providing health coverage for them is less expensive to them from a tax standpoint, as opposed to paying you and bumping your salary.
Raising your salary and letting you buy.
That's right. So the incentive is to provide that health coverage, and that's all growing up. But then the employer has to make that decision.
So the employer could say, here's some options to choose from,
Right.
and then they could still pay it and still get the tax incentive.
And that's exactly the system it ought to be. The employer ought to be able to say, we're going to provide this amount of money, this amount of resource for you to be able to purchase whatever you want. And right now you can't do that.
So we have to have some changes on that.
Those are the kind of changes that you need. But the two principles are: you got to get everybody covered, and the patient has to own the policy.
Wow. All right.
Sorry,
so
we got off on that.
I love that because people don't know that, Tom.
That's right.
They don't have the depth of knowledge about it you do. We only know what we hear and see on television and stuff like that, and that's really cool to learn that from my standpoint. So